So Vamshi is co-founder of Sozo AI. Sozo AI, you will correct me. Vamshi, she brings over 20 years of global experience building, scaling, and commercializing complex innovations and businesses across health, financial services, education technology, and other regulated markets. She really brings a unique end-to-end systems capability across the full value chain: strategy, product, technology, commercialization, and operations, enabling transformations, then really moving from strategy to real world outcomes. She's currently co-founder of Sozo AI, where she leads the development of a privacy preserving, prevention first AI health platform focused on the areas traditional healthcare struggles with, which is early intervention, patient advocacy, continuity of care, and equitable access. Earlier in her career, Vamshi worked in financial services at Goldman Sachs, specializing in quantitative strategies and structured products before moving into leadership and advisory roles in technology-led ventures. Alongside her operating roles, she advises startups at the intersection of deep technology, strategy, and impact, supporting founders on business model design, capital strategy, and building companies that balance commercial performance with long-term social value. Looking forward to hearing from you, Ms. Vanshi. Please go ahead. Thank you.
Thank you so much. May I share a presentation, if that's okay?
Yes, you should be able to. You see the share, yeah.
Perfect. Let me know if you guys can see it.
We can.
Okay. Well, thank you so much. Hello, everyone. Thank you to Dr. Igbe and her entire team for having me here today. So this is really a primer. Today, what I want to do is take you through the story in 3 acts about how AI is evolving in healthcare and health education and what it means for the continent of Africa. So if I say it's starting the story, we went from a specialist AI that helped a few professionals, and we have now reached a generalist AI that can help many. And the future is really about designing right models for a world where specialist hybrid AI and healthcare professionals and educators all work side by side. So this is a primer, and I'll go through it quickly because of the various other beautiful talks we have here. So let's start with what was, right? We had specialist AI in healthcare before this new current wave of AI started, which was narrow, powerful, and limited in reach. As you see, it has helped radiologists, it has helped in genomics and epidemiologists. And in the African context, we had CDC using AI-powered monitoring during COVID-19 and Ebola responses. We have CAD4TB validated in South Africa and Kenya with almost 95% efficiency in national TB screening. And what it does is the specialist AI has been very powerful, but narrow. It helped a few, it didn't touch many. And what this means for on a single workforce, someone commented earlier, is we have a single workforce doing extraordinary work under extraordinary circumstances, not just in the continent of Africa, but everywhere. We know the medical knowledge is now doubling every almost 3 months. The numbers speak for itself. On the left, we have the specialist AI, the few roles I talked about, but really the most of the healthcare professionals, be it in healthcare tertiary education or healthcare clinical side, have not been really using AI. But we know Africa has leapfrogged before. My background has been in technology, and as we say, M-Pesa bypassed banks. Blockchain-based payment technologies are bypassing traditional payment rails in Africa. And we know telemedicine has reached communities without clinics. So taking that to what is now, where we are today is there's a fundamental shift in the AI today. Whereas specialist AI want to be technical, generalist AI meets many of us where we are in our language, in the workflow, and at the level we are. So where this will help across healthcare value chain. What does this mean to healthcare educators? The shift is going to be transformative because whereas specialist AI gave us a handful of tools, think about generalist AI as being your colleague, where it can help you design curriculum, create case-based assessments, create simulation scenarios, all in your natural language. But think about it as a colleague that you have to manage and monitor. As it's not going to ever replace our judgment and our deep experience working with patients. And there are a few generalist AI platforms I've listed here, but I can touch upon a little bit in detail. And let's think about the new wave of AI with a different lens as well. What has arrived is not because before AI has been about doing just a set of tasks. Now AI can execute complex workflows. In the context of healthcare, think about it as writing clinical notes, analyzing images, drafting research, triaging patients, and running operations. So we have to start thinking about this as a second workforce and a talent and not just a feature. To the left side, as we say, humans are there for clinical judgment, empathy, lived experience, reasoning skills, accountability, ethical reasoning, contextual understanding of patients. And think about the second workforce as someone that executes workflows end to end, from information processing at a super speed, uh, but has no empathy, no accountability, needs monitoring. So, what does this mean to educators in healthcare? Is think about this as a very specific implication. When you're teaching students to work with tools, it's not about the tools anymore, right? You're teaching them to manage, supervise, and collaborate with this specific second workforce. This is a fundamental different competency. We need to know how to evaluate AI output critically, when to trust it, when to override it, how to maintain um, our own clinical reasoning when AI handles the information processing very well. So this really think about it as how do we create a new operating system when we think about healthcare education. So AI is a global landscape now. It is tripolar today, where US leads the breakthroughs. China is dominating cost efficient scaling, whereas Europe sets the ethical rules. We all know ChatGPT today, which is widely used. It is strong at explaining complex medical concepts. Anthropic's Claude has detailed reasoning models with very strong compliance. As probably most of you know, Gemini, which is from Google, has very high medical benchmarks. But what is very specific, I feel, for Africa is also the open source models, like DeepSeek, which is a Chinese company. We know it's being used two to four times higher in Africa. It's because it is open source. It can be deployed locally, fine-tuned on African specific issues and conditions and medical data, uh, and to run with the governance that is very local to those countries within Africa as well. And this changes the equation entirely. We talk about innovation. This is where the continent can innovate for itself. And there's Mistral from France, which runs in sovereign AI, which is that means you can run on your own hardware under your own laws. And what is this doing in the African context? I don't think Africa is waiting. It's actively participating to build AI. We already see major global AI companies partnering directly with African governments and institutions. I want us to focus heavily on the health and education and the Anthropic partnership with Rwanda here as well from a healthcare and education perspective. They have offered 2,000 Claude Pro licenses to education space in Rwanda, and also AI learning companions across 8 countries. And think about what Huawei is doing with partnership with Angola, which is more at R&D side. It is training talent in AI and connectivity, but it is also about building AI models for healthcare scenarios that are specific to the continent. And OpenAI, which is open source, DeepSeek models are being used and they're already being deployed, fine-tuned on African data under African jurisdiction, but they're already deployed in tertiary clinics in China. And as I said, the generalist AI reached many year olds now. I'm just giving you an example of the real deployments across Africa, across full healthcare value chain. When you think about community health, Aventix in Kenya, they're using AI for malaria diagnosis in 90 seconds with a very high accuracy across 420 facilities. When you think about educators, I already spoke about Anthropic and Rwandan partnership. And we have OpenAI, which is the company that owns ChatGPT, with Gates Foundation has set up Horizon 1000 in Rwanda, where they're offering, building and offering AI for over 1,000 clinics for decision support, triage, and mostly in multilingual support. And I wanted to now go into what could be, right? I don't believe the future is about choosing what between tools or platforms, and especially in African context as well. It is about innovating and creating that hybrid health system where we are creating the operating models where specialist AI, generalist AI, and human professionals work side by side. And where then this touches and reaches across the value chain within the healthcare ecosystem, and it ultimately where every patient benefits. But this has to be very much specific to the continent and continent needs. I'm just giving you and offering you a few applications that are already grounded in what's already been worked or is feasible across 4 domains, which is clinical practice, health, the education side of it, public health, and system operations. Again, these are specific workflows. I feel the future is really where we are combining these different complex workflows to create efficiencies from health education to clinical practice to broader public health, and then the system operations of the healthcare facilities, including the tertiary facilities. And I want to bring us to more. What does this mean? It is really not about who has more AI in the future. It will be about who has designed the right operating model for this hybrid world. So I'll leave you with 4 key things: is think about is to govern well. We have to build rules before we scale the tools. What does educational institution policies mean for this? What are the human decisions need to sign off? How inputs are audited? What data enters AI? And above all, we need to hire for judgment. As we said, AI is very good with information processing, but we still need those critical reasoning skills as well as judgment. And we need to be able to train our future healthcare professionals to be able to have that and not just rely on AI's outputs. And we have to be very specific about which role and how AI is going to help and what guardrails. And overall, we need to design for equity. And that's where open source is critical for Africa's strategic advantage going forward. And what to watch out for. I'm not going to go through everything, but I think I've focused on the clinical deskilling and digital colonization that you need to be very careful about. And we know already, Ubentix and others have shown a path for Africa to build something that is very innovative and in the context of what the needs of Africa are. So we need to start being a contributor to AI and also design for augmentation always. And fine tuning on African data is essential. It's not an optional anymore. And I'll leave you with a couple of things: is the collapse of average. Being average is not going to be useful anymore. And that is actually going to have a compounding effect, because the institutions that design well, where you have clean governance, trained faculty, specific AI deployment mapped across the value chain, is where you have the compounding value. So for the primer, I hope you take away these 4 things. The shift for AI is really moving from specialist AI to a generalist AI that can help everyone. Reframing that AI is not a tool anymore. It is a talent to manage. And where we need to design and innovate is not about having the best of the platforms or more of AI. It's about that hiring for judgment, building the right operating models. And the future is where we talk about bringing all these